Hello everyone! Today I'm going to explain how to deal specifically with acute sciatic nerve pain. Let's get started. Pain in the leg is a very common symptom, but to understand whether the sciatic nerve is actually involved, there are several signs to look for. The first sign is pain that starts from the lower back or the buttock and travels down the leg, sometimes all the way to the foot. In some cases, the pain appears below the knee, in the calf, or in the foot. Most often, it has a shooting character, sharp, sudden, short, and nerve-like. You may also feel numbness in the toes or foot, tingling, or a loss of skin sensitivity. For example, when you touch the skin on the foot or lower leg, it may feel less sensitive than other areas.
With sciatic nerve syndrome, the pain often gets worse when you bend forward with a straight leg or try to stretch the leg forward. This happens because nerve tissue does not stretch well, while muscles and tendons have a certain amount of elasticity. When you bend down or straighten the leg, the nerve has to move through the soft tissues. If the nerve is compressed, swelling appears. The arteries that bring blood to the nerve have quite strong walls, so they are harder to squeeze. But the veins that carry blood away from the nerve have weaker walls and are compressed more easily. As a result, blood enters the nerve but has difficulty leaving it. This creates significant swelling, which puts even more pressure on the nerve tissue. That is why symptoms can become worse when a person sits or lies down for a long time and doesn't move. Blood stagnates even more, and the swelling increases.
The main goal in this situation is first to remove the blockage, relax the piriformis muscle, or reduce inflammation and pressure from a herniated disc in the lower back. Second, it is important to reduce swelling around the nerve. To decrease swelling, anti-inflammatory medication, physiotherapy, and special exercises are often used. When the nerve is swollen, it is already strongly trapped in the area of spasm. Trying to pull it through that tight spot is almost impossible and can be very painful. But by mobilizing the nerve in the opposite direction, we can create gentle movement, improve blood circulation, and help reduce swelling. According to Michael Shack's research, reverse traction can be created through the healthy leg. The nerve of the healthy leg is connected to the spinal cord, and when it is stretched, it can transmit movement to the blocked, painful nerve. You can imagine it like this. The spinal cord is the central part, and the sciatic nerves extend from it. If one sciatic nerve is compressed and strongly stretched toward the foot, then when you bend or straighten the painful leg, the nerve becomes even more tense. To reduce this tension toward the foot, you can work through the opposite leg. When we stretch the healthy leg, the nerve begins to shift in the opposite direction, away from the foot. So, during the acute stage, we need to relax the nerve as much as possible on the painful side and gently create tension on the healthy side. At first, static positions are used. Later, you can move the healthy leg dynamically to improve blood flow. When circulation in the nerve improves and the swelling gradually decreases, you can carefully start working with the painful side as well. Now, let's move on to the exercise.
If the acute sciatic nerve pain is on the left side, lie down on the painful side. Slightly bend your body. If you can bend more, do so, but only up to the point before pain appears. Do not go into pain. For example, if this is your comfortable level, stay there. The painful leg should be bent to relax the nerve on that side as much as possible. With the healthy leg, create nerve tension. Straighten the knee and pull the foot toward yourself. In the most acute period, you can use a static version. Simply place the healthy leg in a straight position and stay there for about 20 seconds. Then bend both legs and rest for about 1 minute. After 1 minute, straighten the healthy leg again, create tension, and hold the position for another 20 seconds. After this cycle, check how you feel. If it becomes easier, then after 1.5 to 2 hours, you can try a more dynamic version. For the dynamic version, straighten the healthy leg, gently pull the toes toward yourself, then relax. Straighten the leg again, pull the toes toward yourself, and relax again. Do this calmly, without rushing, for about 1 minute. Usually, after these movements, the painful leg starts to feel better.